Hey, I'm Sarah Smith, family doctor, clinical day advisor, and the chatting coach. Welcome back to Sustainable Clinical Medicine podcast, where we're going to be interviewing peers or world experts who can help us think about our clinical day in a way that is more sustainable and create time for our lives outside of medicine. Hi, everybody, and welcome back. Today we have with us Dr. Zhen Chan. So nice to have you with us. Welcome.
Thank you so much for having me. It's nice to meet you.
Yeah, nice to meet you too. Tell us about you.
Yeah, well, a little bit about me, non-career wise. I was born in China, grew up in Miami, Florida. There's a Miami, Ohio that sometimes people get confused with, but I like to reiterate that it's the sunny one, Miami, Florida, with the beaches and everything. Was there for most of my life, went on to New York for my residency, which was in pediatrics, and was in New York for a little bit before moving on to DC. I've always sort of had an interest in blending a lot of different like artistic and scientific aspects and so of like just education and knowledge and skills. And so now I'm doing some pretty interesting things across both clinical and the non-clinical world. I'm married, live here with my partner, with my wife, and we have a pet dog. No kids yet. Our dog is our little fur baby. And yeah, I think that's kind of me in a nutshell.
Wow, very good. Now tell us, what is the clinical place that you're in at the moment? What are you doing?
Sure. So I practice in Washington, D.C. I'm in the fast track side of an emergency room. For anybody who's not familiar with the fast track term, just means like kind of like the urgent care side of an emergency room, the post triage. Sometimes there are still kids that, I need to transfer over or we manage that's a little bit over acuity. But I am a general pediatrician, did not pursue fellowship. I had thought about, or I really wanted to go into pediatric oncology, and I also really enjoyed my ICU rotations, but ultimately kind of veered away from clinically practicing 100% because I was very interested in the entrepreneurial side of healthcare.
Hey, tell us a bit about that. Why? Why entrepreneurship? What did you discover and start doing that was different from your clinical practice?
So back in medical school, I remember it was my first rotation actually. It was my general surgery rotation. I remember meeting the chair of the department for a one-on-one, and I had learned that he was doing an MBA program. And just out of curiosity, asked why, and I continued to sort of ask that question of why whenever I met another attending physician who was doing some sort of certificate program or some leadership program. And in order to the answer kind of had a common denominator of they wanted to take on administrative positions, they wanted to take on leadership positions, get into those types of roles, which often required, maybe not required, but to us, a lot of physicians, we like to have like the credibility. So to us, like everybody wanted to have that certificate behind them and to move up in kind of that bureaucratic world. And I was like, man, I've always been really involved in extracurriculars. I've done a lot of volunteer work. Maybe this is something I want to pursue in the future. Lo and behold, the business school of the university I went to, University of Miami, actually had a recruiter come over and give like an orientation session, information session. And it was about the dual degree MD-MBA program. 1 year scholarship involved. It would just be an extra year between third and fourth year. As many of your audience and yourself probably know, like third year of medical school, when you're starting rotations and your core rotations, is one of the hardest years. And so factoring together all these different elements, what I wanted, the extra year off, all this kind of stuff, and the ability to learn an extra skill set and knowledge set, I decided to pursue it just to keep the window open for hospital administration, healthcare leadership type roles in the future. And during that time, one of the most valuable courses I took beyond healthcare economics, policy, law, all those courses was a process improvement class. And the professor who taught it focused on healthcare process improvement. So I got my Six Sigma certification. And then when I got into residency and here in the US now with the American Academy of Pediatrics or the Board of Pediatrics, like all residents need to be involved in some form of advocacy work or involved in some form of quality improvement work. And I was leveraging a lot of the skill set I got from that process improvement class, as well as the knowledge I gained from the MBA, which is focused in health management policy. And I was really passionate about that work and really enjoyed it. I also started getting a sense, like by the end of second year of residency, like when I was doing inpatient medicine, the hospital door is just a revolving one, and patients kept on coming in, and I felt like I was putting band-aids on situations. And then on the outpatient side, like that longitudinal relationship I wanted to build with families, not that I wasn't having that experience, but oftentimes when a problem was presented, the limited amount of time you're allotted to be with the family was just not enough to go through even the checklist of things you have to get through before you actually get to their presented problems. And if they present two problems, like forget it. Like your schedules now, everybody's wait times are longer. So I just felt like there were a lot of systems issues, and I really enjoy fixing those systems issues. And so, end of second year, beginning of third year, I started this journey of networking. I started this journey of networking and meeting all sorts of people working in the healthcare industry beyond clinical practice. And, consultants, venture capital, CDC, WHO, research, pharma, insurance, you name it. Like, I always just asked for another connection to another person. And then that kind of solidified the decision for me that I wanted to, in the same way that my colleagues were going on to do a 3-year fellowship in their subspecialty, I was like, I want to go try out the entrepreneurial side of things. I really liked what people were doing in the venture capital side and working with the early stage companies. And I started getting very exposed to people who just had creative ideas and wanted to like make it happen. And the impact of that success is on a much broader scale than anything you can do on an individual patient visit, to me. And I really kind of crave that. And so that's sort of how I got into this side of the world. But I never want to lose sight of the clinical piece. I never want to lose sight of the patient experience. And so that's why I plan to always have some level of practice in my career.
Okay. What did you set out to be learning about? So what was the idea that you had for improvement, or what were you kind of working towards in terms of a goal of, I see this as a problem and I want this
Mhm.
fixed. What was
Yeah.
that even initially versus now?
So initially, it was a lot of care access was kind of the, I would say, umbrella problem. And care
Mhm.
access is so broad, and there's so many different ways you could tackle care access, from workforce shortage to just care coordination to making sure that there's proper numbers of grocery stores in a community so people can have access to fresh produce, right? Like there's so many different ways that you can define care access. I felt well equipped with what I was passionate about, and what I was good at was making connections with other professionals in the field. And so I decided I wanted to try to tackle this from the workforce shortage and optimizing where people were kind of direction. And so that's how I ended up founding the community that I'm architecting or behind, which is called Grapevine. And originally it was a sort of better job board. My idea was, there's so many recruiters out there that constantly text us and constantly email us about jobs that we're not really often interested in. Sometimes they're not even jobs we're eligible for. Like I give the example that I got reached out to for an ophthalmology job, and I'm just like, I not like you're wasting your time. I'm not even eligible for this position, right? And then I learned a little bit more about, the cost, the administrative cost of recruitment for a lot of health systems. And that cost, honestly, is too much for a smaller independent practice to bear. Oftentimes, in the US health system, at least, we talk about how like the independent practice is slowly going away. And well, actually not even slowly, it's rapidly going away. And it's a lot of times because of the level of coordination and the just overly expensive costs of maintaining a practice. And I thought, okay, I can, relieve the problem and the pain point of these spammy, just irrelevant outreaches that we're getting for the physician side. And then I can also maybe if we're just doing a better kind of network powered, referral powered job board with a better experience and user interface, then I can also price it way cheaper for these independent practices, rural practices, maybe heavily public insurance dependent practices to afford this type of recruitment and get their jobs visible, get their roles visible. And so I kind of just went off on a journey of building that for quite some time. That started in March of 2023, and then March of 2024. And then March of this year, I sort of made the decision because it was just taking too long and resources were running slim on commercializing that product. I pivoted away from it and really just sort of dedicated my time to building community. It was always sort of part of the broader vision that if I'm going to build this network that of physicians signing up for this platform and seeing jobs and referring, that there's something that can be done for this network. Burnout is a major issue, and I sort of transitioned into looking at what do I think are some of the major contributors to burnout? And I think one is we do not learn the skill sets and knowledge about healthcare beyond the clinical practice itself enough to speak the language that all the kind of owners of that back end are speaking. And that causes us to lose autonomy in our work. So that's one. And two, I actually think social isolation is a major problem. And when I was in my MBA, I had a networking event basically every week. Going back into med school, into residency, it was like the one conference a year or whatever it is. And once you're out of training and out of education, you no longer have that built-in system for you. And so if you feel stuck in your career, you're networking fresh at a much later stage than professionals in any other industry. And so I now am really focusing Grapevine to kind of tackle those issues because I think if we can improve burnout, improve moral injury, improve social isolation, all these kinds of factors for the medical professionals at the front line and educate them about the back end of healthcare, then we can kind of take back that autonomy, take back that power. We'll burn out less, and then there's better access overall, right? Like, so kind of my North Star is making sure that what the advice I received when I was shadowing is not the advice that's given to the next generation of aspiring physicians, which was if I were to go back, I wouldn't do this again. And I don't want that to like keep happening.
Yeah, yeah. What were you noticing about you and your colleagues within your residency and maybe early clinical career that wasn't going so well for you?
Hmm. I want to say it's a lot of that sort of lack of knowledge of the back end. It's not understanding, when like the billing and coding pressures or like what these codes mean and how once you enter it into the EMR, what that translates to. Why are practices struggling? Why do rural practices not have people there? And us just not understanding that entire landscape and not talking to the people working in that area, like I've never spoken to a billing person in my life until until after and I started building this community. I rarely saw us having a networking event or some kind of social event with the unit case manager or the nursing staff, right? Like that just never happened. And I think that causes a lot of problems in terms of a work environment dynamic where everybody kind of sees others as others, right? Like, oh, those are the nurses. That's not me. The nurses will see us as like, oh, those are the residents. That's not us.
Mhm.
And then when we're calling consults over the phone, you think you're just talking to some like automated robot that's just going to like do what you want them to do. And I think that just makes for a very terrible work environment. It's just a very toxic way to work. And I think that like we're not just sort of these robotic frontline service workers that sometimes these systems can make us out to be, and we need to kind of bring that humanism back into the workspace. So I don't know if people actively, I wouldn't say I think my colleagues actively thought about that all the time and like saw it that way, but it's definitely like something that I saw
Mhm.
and I just was very dissatisfied by.
Yeah. I noticed at the beginning you said you've got all these things you've got to kind of tick off, and then you can get to the problem of the day. And help us, heaven help us if there's two things to handle today, because it's just not going
Yeah.
to be fitting within the time we're allotted. So I think the checkbox thing, do you feel like that's part of that billing, coding, how we fund ourselves, kind of administrative burden, followed by the clinical burden, followed by the time burden
Yeah.
of clinical practice day? And have you had any insights on how you can navigate that in a different way? Is there anything that's come up that's been like ideas on how can we start to poke at that health system a little bit so we can create more time for the patient and the
Right.
physician, the team to do their quality work for this person?
Yeah. I don't mean to sound cliche or just like kind of beat a dead horse because it's just what's in the zeitgeist these days. But I think the most sort of transformative piece of technology that we've gotten in the last couple of years is the AI powered scribing tools and the translation tools and all the different agentic AI tools that are coming out now to help with that admin backend and really sort of take away some of that quote unquote pajama time. Some of these AI tools that I'm seeing, they're giving you even suggestions on the codes. And it's all about taking away that cognitive load, right? Like when I'm seeing a patient, I just want to see the patient. I want to help them fix their problems. I don't want to, at the end of a visit, try to scramble and think, oh, wait, what was that? Was that a 99212? Was that a 99235? Whatever, right? Like that's not what I went into this career for. And so some of these tools just saying, hey, based on the conversation I listened to, well, first of all, here's the note, right? And the more notes you have me write for you, the better I can tailor it to your type of structure. And then here are the codes that I think are going to be best fitting for what you're doing and for this visit. And so I think a lot of that is taking away sort of the admin burden that we never set out to want to do in the first place, but that was just placed on us because otherwise it's extra overhead, right, for the system or practice to have to hire more people to do the billing and coding part. So it's like, hey, if we can get the doctors to squeeze this in to their schedules and they're altruistic and we can kind of take advantage of that, like why wouldn't we? Right. And so I think some of these tools that are coming out are definitely taking a stab at improving our charting abilities. But also, like, for people who are not really technologically savvy, I think, having kind, patient individuals, honestly, like yourself, from reviewing what the work that you do and your team does, to help people get through their charting, get through their administrative work, help them like create dot phrases and templates and all these kinds of things. That's another way to kind of have a human component to it to help take a stab at that. And then finally, just education generally. I think we don't, again, going back to what I said earlier, we don't get educated enough on this part of our job. And maybe arguably it shouldn't be part of our job, but it is. And so getting educated is just a necessary evil.
Yeah, I think when we're told, I need you to tick this box now, I need you to tick this box too, and we're not given the true why behind the scenes or the true understanding of what is it that creates for us
Hmm.
that's of benefit to me, to benefit to the patient, advocates for, or gives us more funding so we can now go and hire and recruit more of us. If there's a level of understanding, that can make it so much easier for all of us, for all of our
Yeah,
team members, us ourselves. Why are we doing this? Because if we're just doing it for the sake of somebody told us to, that becomes really rather resentful, rather fast.
absolutely.
If we,
Sorry, I
yeah,
think you
so
you you had cut off for a second there. Yeah.
I think if we have some sort of understanding behind the scenes of what is happening that creates what happens when we do some of these things. But then again, I love that you're saying sometimes down the pipeline there could be, as we listen into these conversations, we can now fill in those, tick those boxes on your behalf.
Yeah.
Hooray.
Yeah.
Because I
Yeah.
still don't want to tick them. I don't care who wants
Yeah,
that.
yeah, yeah, yeah. And you actually brought up something in my mind that I think a lot of physicians when they're doing this part don't think about is like a lot of scientific research is frankly based on these codes and our notes, right? Like a lot of retrospective research and prospective research like is based on this kind of stuff. So accurate documentation is important for public health measures, for the funding that you just mentioned. If you're working like here, there's these designated federally qualified health centers, what you document and that goes into your risk scores, your quality scores, all this kind of stuff that factors into the grants that your practice can get. And your practice is providing a service that without these grants can't exist. And so the idea that all of this administrative work actually does end up factoring into your overall ability to care for patients, even though you don't feel that, is something we need to educate people more on.
Yeah, yeah. Okay, is there anything we haven't spoken about that we should be talking about today?
Ooh, I think I touched upon it a little bit. I really want to evangelize the concept of networking for our profession. I think like for, when I was in that last year, sort of exploring what I wanted, it was really coming from, I started networking because it came from a place of need, right? And I learned very early on from one of the earliest people that I spoke with during that journey of like, whenever you meet someone new, ask to get introduced to another person. And sometimes this networking, it's like preventative medicine. It's like primary care. It's primary care for your career and your personal well-being. Because if you meet more people now as early as possible in your training process, the more people you meet, the more people you can potentially tap into and get support from later on in your life. And I'm not saying like, meet people and make friends just to use them. That is not what I'm saying at all. I don't want people to think that. But it's just like that availability is there. And you always want to do like a little kind of give get. Like I always take networking as like a let me give first, right? Like I'm not going to ask for much. I'm just going to like see who I can provide you. If I'm talking to you, I want to try to think like who can I provide you? What resource do I know can I help you with? What Substack, what social media influencer might be in the realm of what you're interested in that I can introduce you that's valuable to you. And then that way like you've given something of value and then potentially they will give something back. Like you don't know, but the odds are probably better. And I just really want to emphasize that networking is not something that just should be left to like the finance bros and the administrators and CEOs and whatever. It's important for our careers as well, especially in the modern practice of healthcare, where I truly think clinicians, not just doctors, but the nurse practitioners, the frontline registered nurses, the techs, everybody really, like we all have diverse desires about our career. And we want to try to meld everything together oftentimes. And so the more people you meet, the more people you can kind of get to support you through that process, the better. So I just really want to emphasize that. And that's really why I'm building the community that I'm building.
Yeah, we know connection's so important for trauma mitigation and for burnout
Mhm.
mitigation. And like you said, just different ideas for your career or different ways of doing things. When I talk to physicians in the room and we talk about just how they start conversations, how they're running their clinical encounters, like that is a private space where you're with a patient and you're doing your thing alone and isolated. But as we start to talk about how we do things, we can learn so much about how others are doing even just their clinical practice, and it can help you kind of get out of a little rut that might be creating additional time burden in the room that's not necessarily needing to be kept there. Just as an
Right.
example, how does networking, how does connection make a real impact in our world? Tell us about what it looks like to be a physician who's also an entrepreneur. Like, have you had any ways of rethinking that piece about I'm
Yeah.
a doctor and I'm an entrepreneur, and is that okay? And do you see that in
Yeah.
others doing similar things in entrepreneurial doctoring?
It's 100% okay. It's very scary. I think most doctors kind of have that type A risk averse, like type A risk aversion, regimented and like needs all the information possible before making a decision. These are sort of qualities that are more stereotypical of our profession. I've always considered myself more type B, so like I'm a little bit different from the mold there. And then the risk aversion piece, I think that's just something that it's like you need a little bit of exposure therapy just to kind of get over that, right? Like if you're creative and you're a heart surgeon and you're thinking of something that doesn't exist and you want to like kind of make that happen, go meet the people who can potentially help create this product or create this thing. And like you not only need the scientist, you need the clinician, you need the entrepreneur, you need the salesperson, you need the marketing person. Start building that coalition for yourself, right? And don't be afraid to just put it out there. Sometimes like one of the quotes that I've kind of latched onto is like, don't let perfection be the thing that prevents you from good or whatever. I'm paraphrasing that. Like sometimes you just need a place to start and it will allow you to like your clinical practice is what allows you to make an impact on individuals one after the other. But sometimes if you have a creative idea and you really are passionate about it, that can then allow you to make an impact on a broader population, at scale and scale that impact. And that's what sort of the entrepreneurial side really brings out. So I 100% think that it's doable, it's important, and I think people need to see that there's a lot of parallels. Like I actually gave a lecture at a school recently to medical students that are on an innovation and practice innovation and entrepreneurship track, basically paralleling our process of clinical care with quality improvement, how healthcare quality improvement is done, with building a startup and building a company. And there's a lot of parallels, right? Like I basically showed that like, hey, pre-rounding on a patient inpatient or pre-charting at home is your plan cycle. Your plan cycle is the equivalent of you're doing research to like see how you're going to build this company. And then in QI, the next are DSA, do, study, act. The doing part is getting the team together, like performing the thing, making the change. It's the same thing for patients when you're recommending a treatment plan. You're doing something. And then you're studying it when you tell them to come back in 3 months, or you're rounding on them the next day to see if they're improving or not. And then you're making a new plan, right? That's the act. So the plan, do, study, act cycle is what applies in quality improvement. It applies to you going through a patient case, and then it applies to you building a company. You don't want to stick to something that's not working in a company either. So that act part is based on what you study. And every quarter, you're like, all right, I got to make an adjustment. I got to pivot. And so having, I think, clinicians understand the parallels there, or just visualizing that a little bit better, will make people a little bit more willing to make that jump into entrepreneurship.
Yeah, got it. That's so fascinating, actually, that they even have a track for that in medical school. Like, what?
Yeah. I love it. I love that a lot of medical schools with their newer curriculums or curricula are implementing different tracks for different interests. So like the school I'm thinking of, they have this track, they have a healthcare leadership track, they have an advocacy track. And then and then other schools also that's like expediting it. So it's not 4 years of medical school, it's 3 years, and it's a primary care track, because we need more primary care and prevention medicine so that, the patients aren't only seeing doctors when they're having the heart attack.
Yeah. Is there anything that you've brought into your day-to-day in the pediatric fast track clinic
Mhm,
about what you've learned? So is there things you're noticing about how the environment is already working, or things that you've
mhm.
implemented? Just kind of bring in some of these principles to home.
Yeah. I try to bring in all, like, being working in the space that I work in, I learn constantly of like new startups, new technologies that are coming out, and things that are maybe free to try, free to use. And so I try to educate my colleagues as much as possible about the same landscape that I'm learning about, right? Like even incepting the idea into some of my colleagues, like that's good enough for me. It's, I'm not gonna make the institution use some of these products or anything like that. But just so like, you're starting to build that coalition, you're starting to get everybody to think about that these technologies are out there and maybe there's a better, more efficient way to do something, then that kind of grassroots starts spreading. So I do a little bit of that. And then honestly, just like kind of bringing that, extroverted, willing to connect, sort of empathic attitude, not just to patients, but to my colleagues, chatting with the nurses, getting to know them, and hoping that like you can role model these behaviors that you see a lot more, honestly, sometimes on the business side. And so trying to role model that so that the workplace environment is also improved. I try to bring that a little bit as well over.
Love that. Very good. How do
Yeah.
people find you if they're looking to connect?
Oh yeah, great question. So my website for the community, which is again, it's for doctors all over the world, medical students all over the world, for advanced practice providers, so nurse practitioners and physician assistants. I'm not sure if internationally those roles are equivalent, but all of them, it's free to join. The website is grapevine.health. Grapevine spelled with a Y instead of an I. And then I'm on TikTok and Instagram and LinkedIn. So, just searching my name, Zhen Chan, on LinkedIn, you'll find me. TikTok and Instagram, I'm Zen_MD on Instagram and ZenMD, no underscore on TikTok. I try to put out a lot of content that is bringing healthcare concepts into digestible 2 minute, 3 minute pieces. So we talk about like insurance programs or value-based care, or, like here in the US, like PBMs, the pharmacy benefit managers, like what are all these players doing and how do all these things work? I try to make it into digestible, educational little sound bites.
Love that. Okay, well, thank you so much for being on the call today. Thank you for expanding our ideas on what's available and the joys of connection.
Absolutely. Thank you so much for having me, Sarah.
All right. See you all next time. Hey, if you found this podcast episode helpful, I would encourage you to like and subscribe. Every time you do, you help a colleague or friend find our podcast, and it can help them too. Don't forget to share it along with your friends. If you're looking for extra help, don't forget we have charting champions for physicians and smarter charting for nurse practitioners and other clinicians to help you get home with your work done. We are helping you create sustainable clinical medicine. Thanks for listening.